So, Dr. Sattler, why did you become a doctor?
Well, I became a doctor because I love medicine, I love biology, and I love being with people.
Right. And from what age? When did you decide?
I decided I wanted to be a doctor when I was about 5 or 6. Yeah.
Really?
Yes. And at that time, all you could get for Christmas was a little nurse's bag. But so they gave me a little nurse's bag, but I pretended that it was a doctor bag.
And did you? Can you? Did you play doctor? I mean, did you?
Not in that way, no.
I started walking with the question before I realized where I was going.
But I did, um, sometimes pretend that my dolls had little problems, and I would diagnose them or put a bandage on them or something like that. Yeah.
Were you a candy striper?
Yes, I was.
You are.
I was. I was a candy striper in high school. I was a junior and a senior. We wore the little outfit with the little stripes and everything.
Yeah.
Very cute.
Yeah.
And I worked in the pediatric ward at Columbia Presbyterian Hospital, and it was very interesting. It was my first real inside look at medicine, and I remember the interns trying to draw blood on the little infants and on the babies and how the babies would cry, and they gave us the job of helping to feed the babies. So we would sit in these big rocking chairs with the little bottles, and the nurses were great. I've always had a great respect for nurses, and I think that's helped me in my career because I feel we're all part of the same team.
Right.
Some physicians feel, okay, here's the physician and here's the nurse, but I don't think that way.
And when people ask you what you wanted to be when you grew up, did you say doctor?
Yes,
Yeah.
I did.
Yeah. And where did you go to college and medical school?
I went to college at Wesleyan University in Connecticut, Middletown, Connecticut. Fine education, very cold. And then I went to medical school at Howard in Washington, D.C.
And what kind of experience was that?
That was a great experience. I met people that are still my friends. The professors and the staff were totally dedicated to turning out excellent physicians. I met my husband there, Oscar Streeter, so it was an all-around wonderful experience. And we gave great parties at the end of exam time too.
And how did you develop your specialty?
My mentors were endocrinologists, and so they were internists and endocrinologists, and I basically pretty much followed in their footsteps. Became an internist, worked for years as an internist, and then right before I became ill with breast cancer, I started getting acupuncture and was very excited by that as a treatment modality. So when I got better, I studied acupuncture and then wanted to have a practice where we did both. And after that, branched out into other aesthetic services, basically because my patients had needs, and I felt if I could help meet those needs, it would be good for them.
What convinced you about acupuncture?
For me, 2 things. One, I had arthritis in my hip, and it reduced the pain considerably without the use of medication. I have problems with many medications, so I wasn't on any, so I could really feel it working. And the secondly was when I was getting my chemotherapy, I had considerable nausea and vomiting, and my therapist came to my house and gave me some treatments, and it really helped me. It helped me quite a bit. Also helps with energy when you have low fatigue, because that's what it's doing. It's using the needles to unblock the energy in the meridians and to open that up.
Yeah, a friend told me to go to acupuncture for elbow problems, and I'm a believer.
Mm-hmm.
It's just, I go twice a week.
Mm-hmm.
It's amazing, and I have no idea how it works, and I don't really care. It just does.
Right, and nobody really totally knows how it works, but we have ideas. Of course, there's a lot of acupuncture theory, but it does work. It doesn't work for everybody, but what I tell the patients is nothing works for everybody. There isn't a single pill or surgical intervention that has 100% benefit, so you have to look at it that way. And we use acupuncture as part of the total treatment plan for that patient. So let's say you have arthritis. You may be on some medication, getting some acupuncture, doing physical therapy. It's part of the whole plan.
So what is your specialty?
I'm an internist. I'm a board-certified internist, and I'm a fellow of the American College of Physicians.
So what is an internist?
An internist is someone who basically helps to diagnose diseases and to treat them. High blood pressure, diabetes, heart disease, certain gastrointestinal problems, you're likely to go to an internist first. And that person will help figure out what's wrong with you and then refer you to the cardiologist, the rheumatologist, the oncologist, that sort of thing.
Okay, I'm going to go out on a limb here. Have you heard of a doctor called Sally Satel?
No, I haven't.
Okay, she wrote an article for the New York Times Sunday magazine, and I just remember the first sentence was to the effect of, if I didn't take into account my patient's race, I wouldn't be doing my job. Is it true that people of different races or different ethnic backgrounds have different predispositions to different diseases?
Yes, there are different risk factors for different ethnic groups, and in terms of medications, some groups respond better to certain medications than others. For example, in the treatment of high blood pressure, there might be certain meds that are better for one group than another, but that is true.
Wow.
And there are also genetic predispositions, like some groups will get a particular disease that other groups won't get, so you have to look at that.
Mm-hmm. It's kind of a scary and fascinating world.
It is, it really is, and I think when we have better use of the DNA breakdown that the scientists are doing, we'll be able to sort of get a fingerprint, if you will, of a person's particular disease. I know they're working on that in cancer treatment. So that, let's say if you needed chemotherapy, they would be able to use the profile of your tumor cells and figure out which agent was the best one for you.
How much do you have to work with how much are you able to influence people's spirit? I mean, when they come in here, I can only imagine what it's like to have cancer. And I can only imagine that so many people with cancer just want to give up.
Right, that's true. That is one of the hidden beauties of acupuncture, actually, is that we do a lot of psychological assessment, a lot of psychological work for the pain patients and the cancer patients. Many of the pain patients they're irritable and grumpy, they're in a lot of pain, they've been to a lot of doctors, they haven't had relief, and as the acupuncture starts to work, we can sort of see their true personality begin to emerge. Usually by the third or fourth visit, they can laugh and joke with us. You know, they can say, oh, I heard this funny story, something like that. You can really see a difference. And also, I think people will frequently tell someone who's doing acupuncture things that they may not have shared with another practitioner, simply because we are doing points that help bring some of those issues up to the forefront.
So do you actually deliver the needles?
Yes, I actually put the needles in, right.
Yeah.
Mm-hmm.
So you first started out getting acupuncture and you realized how much it helped. And
right.
That's what prompted you to
get
a study.
Exactly. And if you had told me, 15 years ago, well, you're going to be doing acupuncture, I would have looked at you like, what are you talking about? Not that I was against it, it wasn't part of anything that I had really thought of or planned. But that's the interesting thing about life, isn't it? You start out in one spot and then you end up somewhere else and loving it,
Is acupuncture more popular in California than, say, the East Coast?
I think it's very popular on the East Coast and definitely in California. And I think there are many places in the Midwest where it is becoming more popular because you have more people doing it, both physicians and non-physicians, and it's more in the literature. There was a huge study that was done that they talked about at the recent ASCO meeting, which is the American Society of Clinical Oncology, that talked about the use for acupuncture in cancer patients. So it's really getting more mainstream, wow, which is exciting.
And how do your other physician peers relate to acupuncture? I'm sure that many of them just dismiss it as nonsense.
Some do dismiss it, yes. But over the years, I have seen more people give it credence and more people willing to refer their patients to me to try those techniques. I have some physician colleagues, particularly at USC, who have been backers of me from the start, and it's been wonderful. And I've treated their patients, they're rheumatologists, and they've sent me patients over the years. There are some surgeons, particularly orthopedic surgeons, who have found it to be particularly useful for their patients post-operatively. That means after, let's say you were injured at work to your hand, you've had your surgery, you've done physical therapy, you still don't have full function or you still have a lot of pain, then we take that patient and work with them. And